So I just wanted to start out by saying thank you all for being here today with me, and also for those of you who are going to be watching this online. Thank you. My name is Laura Waters. I'm an account executive at GHC Group Health Cooperative. And today I just wanted to go over just some helpful tips as to where to access care. I just wanted to give you a little bit of a background about GHC. First of all, we are a very small HMO. HMO means Health Maintenance Organization. We were the first health maintenance organization in Dane County. We started out with 296 founding members to 78,000 today. Also, I wanted to just mention about GHC and why we're very active into the community, why we stand out from other insurance carriers. This is just a little bit of an overview of some of the ways that make us a little different. For one thing, we have a staff model approach. So GHC clinics are a one-stop shop for primary care, lab, radiology, and pharmacy. And we also provide care on demand through our Nurse Connect, our GHC Care on Demand. And also, we wanted to let you know that our providers, our GHC providers, are actually paid a salary, which makes it a little different than other providers, that they are paid to spend as much time as needed with you. They're not going to try to have you come in and then try to get you out as soon as possible. These are people that really take a good deal of care in your health care. So I wanted to briefly go over the benefit summary for your plan with GHC. First of all, your primary, specialist, and urgent care office visits are 10% paid after deductible. Now, as you can see on the second line, your deductible for a single is $100, that's per plan year, and $200 for family. So if you were to see a specialist, for instance, your benefit would be that you would pay $100, and then after the $100 has been met, you would pay 10% of the service. I do want to point out, very importantly, that if you go and see your primary care physician, and your primary care physician is in Madison College Community Clinic, there is no charge for your office visit. So we designed the plan so it would be very easy for you at Madison College to receive care. So again, to point out, your office visit, if you go to Madison College, would be no charge. If you go to other primary care physicians that are outside of the Madison College Community Clinic that are with GHC, so if you go to another GHC clinic, that is fine. Your benefit would just be a bit different. And that's when that $100, 10% would come into play. I want to mention without confusion that you do have a maximum out of pocket per member and per family. The out-of-pocket for the member is $2,500. That's per plan year, $5,000 for family. Now, I want to mention that that would be including any co-payments for drugs that you would pay. That would include any emergency room visits. That would include your deductible and also your co-insurance. So the way that your plan is set up is the maximum that you would pay out of your pocket for eligible charges would be $2,500. More than likely, unless you would go into the hospital, you probably won't experience having to even work with the maximum out of pocket. But I just wanted to point out that that is how your plan is set up. I mentioned that Madison College Clinic is where you would need to go and have your office visit paid in full. You do have the option, though, to go to another GHC clinic. So this next slide is just showing where these clinics are. And that picture, of course, is Dane County, and you'll see where Madison College is listed. Other clinics that are around the county are the DeForest Clinic, East Clinic, Capitol Clinic, Hatchery Hill Clinic, and Sauk Clinic. So again, you can see providers in any of these clinics per your plan. The benefit would be different if you were to go to Madison College, which again, your office visit would be paid in full. If you're trying to find a provider, you would just need to go onto our website, which is ghcscw.com. On the main page, you would just click on clinic or provider, and you can search either by clinic or you can search by provider name. Here's more of a detail of how to find an in-network pharmacy. Again, you would need to go to our website, ghcscw.com. You would then go to health insurance, and it's showing you on that little picture there where that's at the top of the page, and then understanding your pharmacy benefits from the menu. I do want to note that we actually have a very vast pharmacy network. So there are of course pharmacies that would not be affiliated with GHC, but if you ever had any question as to whether a pharmacy was a network or not, you could, of course, go on the website as I just explained, or you can contact our member services. The ones of note that I can think of that would not be part of GHC network would be any CVS pharmacy or Target. Those are two big ones that are not in our network. I wanted to start by explaining that there are many different ways to access care with your plan. One of the most important ones at this time, due to most of us being at home, is GHC Care on Demand. So it is a video doctor visit. So you can access GHC Care on Demand by desktop, phone, or tablet, and you have free unlimited visits. Now, what you can see a provider for is many different conditions. Some of those are listed. For medical, of course, if you have an ear infection or a headache, you can see it. You can set up a video visit with GHC Care on Demand, see a provider, and receive treatment that way. But I also want to point out, especially during this time, that there are behavioral health services that can be provided and are accessible to you. There's they are available on GHC Care on Demand, and that includes therapy. It also includes psychiatric visits. So in the event that you are having a difficult time making an appointment to see one of our GHC behavioral health providers, then you have access always to this GHC Care on Demand. Again, 7 days a week, 24 hours a day, you have access. One other thing I'd like to note about GHC Care on Demand is that, as it mentions on the slide, it's great for travel. And so if you go someplace within the United States, you can just go on to GHC Care on Demand and set up an appointment, and you'd be able to have a visit that way. You also, again, because of the situation that we're in, of course, most of us being at home, not wanting to travel too much, we do have virtual care and video visits available provided by our GHC providers. So you can go onto your MyChart account and you can set up a visit, and you can see your GHC provider virtually if you do not feel comfortable having the service actually in person. So this is treated just the same as any other visit that you would have, any other physical visit that you would have, where you could see your doctor for any kind of minor health condition, and it would be considered the same as any other visit that you would have, meaning that if you had this virtual care visit provided by a provider at Madison College, these services would be of no cost to you. Another thing that we offer is Virtuel, and Virtuel is also a 24-hour, 7-day-a-week online clinic that we provide. And what you would do is you would go on to ghcscw.com, which is our website, /Virtuel. You would describe your symptoms in a simple online interview. Within 30 minutes, a nurse practitioner would be contacting you to create a plan, provide prescriptions if necessary. So this one's a little different because this isn't actually a virtual visit. This is just an online clinic visit. And it also is normally for common symptoms. Take, for example, if you have a sinus infection, you're prone to sinus infections, you know you need medication, you can just go on to Virtuel, you can describe your symptoms, and if the nurse practitioner determines that you need a prescription, they can get that for you. So it's really an easy access to treatment, and this is free of charge as well for you. Unlimited visits, free of charge. I also want to point out that I would encourage every member who has questions as to whether they should seek treatment or not to contact our Nurse Connect line. And the number is, of course, on the slide here, but you can give them a call 24 hours a day, 7 days a week, describe your symptoms. They can either give you advice or they can maybe give you guidance as to where you should go for treatment. If it's something where they determine, okay, you need to be seen at urgent care, they can help coordinate a visit for you there. So they can help with the appointment. Same with if you were just to be seen at your at your primary care clinic. They can assist with appointments if they deem that that's necessary. I think I mentioned before MyChart, and I hope that you are all familiar with MyChart. It's our online account, a member account, where you can message your provider, you can refill prescriptions, you can view test results, you can schedule appointments. I mentioned before about the virtual visits with your GHC provider. You can make those appointments on MyChart. So this slide is actually explaining how to register and activate your account in case you don't have one. But something else I would highly recommend that you do for yourself. It's very easy. All of your medical, all of your information is private on that site for you. I also want to mention that GHC MyChart is also available on an app for your phone. So you can just go to your app store, whether it be Apple or Google, and download the MyChart app, and you can have it with you on your phone. Another thing that I can mention that it's very useful for, if you don't want to carry your ID card, for instance, you have an actual virtual copy of it on your MyChart account. So if you have that on your phone and you have a provider asking to see that, you would be able to provide it just on your phone. I also want to go over the all-new GHC Smart Care app. So this is another app you can download from the App Store, either Apple or Google Play, and it's just a place where you can have access to Virtual and to Nurse Connect right in the one app. So I would suggest that you download that. It makes it super easy, so that way you don't have to look for the Nurse Connect number. You would automatically just be patched through using that app. Same with Virtual, in case you wanted to use that. You have a headache, you have a sinus infection, you want to have some medical advice that is accessible through that app. So it's just another way of having your treatment right on your phone. GHC is very, we believe in complementary medicine. So we believe in traditional and non-traditional medicine working together. So you do have access to acupuncture, to massage therapy, to Reiki, to reflexology. Of course, you do need to go to a GHC provider to have these services done. But as you can see from this slide, it gives you instructions on how to schedule an appointment. But that is something that we do offer all of our members, which also makes us a little different than other insurance carriers. I just wanted to throw this one in. This is new as of January 1st, 2021. This is our new wellness initiative. It's called Manage Well. So you can access Manage Well by desktop, phone, or tablet. So there's an app, of course, for Manage Well, and you can earn rewards by syncing up your Fitbit, your Garmin, your Apple Watch, and if you do certain exercise, if you walk a certain amount, I believe it's 8,000 steps or 10,000 steps, get points for that. And if you get 100 points per quarter or 200 points per quarter, you are eligible for a reimbursement that could be up to $100 to $200, depending upon how many points that you were able to get in that quarter. So this is just information about it. I would just suggest going on the website, taking a look at what other activities that you can do in order to access those points. Here's the slide about emergency care. So if you need to go to the emergency room, these are the two hospitals in Madison that you need to go to. One is the University Hospital, the other is Meriter Hospital. To point out, emergency care is for life-threatening medical conditions that can cause serious danger to your health. So I wanted to kind of give you examples of conditions that maybe you should go to the emergency care, and some examples of conditions where you would need to perhaps go to urgent care and you would be very suited to go there and you wouldn't need to go to emergency care. So examples of going to the emergency room: if you have any kind of alcohol or drug overdose, if you have severe lacerations or amputations of limbs, if you have complex bone fractures, if you have any complications during your pregnancy, if you have chest pain, if you have respiratory problems, if you have any kind of poisoning, those are examples of when you should just automatically go to emergency care. So you would automatically go to either the University Hospital or Meriter. Examples of when to go to urgent care: if you have any kind of back pain, if you have ear pain, if you have the flu, if you have a sore throat, a sprain, if you have a migraine, these are more conditions that can be treated at urgent care. Now, where you need to go for urgent care is right here, Capitol Clinic, and that's on West Washington Ave. It's downtown Madison. And we handle, at GHC, we handle our urgent care a little differently, where urgent care, you would need to call and make an appointment. And we find that it is so nice because most people that need to go to urgent care probably don't feel like going to the clinic, but they need to. So when they make that appointment, they know that their appointment, for example, is at 1 in the afternoon, that they can rest until that time. And then as of 1 o'clock, you can be seen for your urgent care visit. Now, that's not saying if you did have something urgent come up, you could go to the clinic and without an appointment, but you would need to, of course, wait there until they were ready to see you. So that's kind of why we have it handled a little differently, where we actually suggest that the member call and make an appointment for their urgent care visit. So again, there are many situations where urgent care would be a better fit for you than the emergency room. Emergency room, you are more than likely going to be waiting for a while because you're with a lot of other people that need emergency care. So, if it's a situation like the ones I just presented, a condition where I just presented, urgent care would be a better and more economical fit for you. Pharmacy care. I think I mentioned that our pharmacy network is pretty extensive. So here are some of the bigger pharmacies that you can go to pick up your medication. So there's Costco, there's Walgreens, Medicine Shop, hometown pharmacies. Really, if you have any questions as to whether your pharmacy is in network, please do not hesitate to contact our member services department and they can assist you with that. I just kind of wanted to go over every clinic that you have access to. Of course, most importantly, the one at Madison College, where your office visit would be at no cost. So they provide primary care there. They also provide lab services, radiology, and health education. For example, if you just found out that you were type 2 diabetic, you can have a health education visit and they can kind of go over you know, what you can eat, just kind of go over what to expect for your treatment for that type 2. Over on the east side is our East Clinic. Again, that is available to you. They do provide primary care there, chiropractic, podiatry, mental health, complementary medicine. I mentioned about the acupuncture and the massage therapy. They also provide physical and occupational therapy there. DeForest Clinic, that is in DeForest, and they provide primary care. That's one of our smallest clinics. Again, Capital Clinic, this is where you would go for your urgent care, but they also provide primary care as well. There's also chiropractic services, complementary medicine, physical therapy. There's also a pharmacy at Capital Clinic, so you can go pick up your medication there if you choose to. Hatchery Hill Clinic, that's on the south side of Madison. It provides primary care. This is where you would get your yearly eye care. So your yearly eye exam would be here at Hatchery Hill. Any kind of advanced medical imaging would be done at Hatchery Hill. That would be for like mammograms, etc., CAT scans. Dermatology is also there. Pharmacy, chiropractic, mental health services. You can also have complementary medicine there and health education. Sauk Trails Clinic is on the west side of Madison, also providing primary care, chiropractic. There's a pharmacy within there as well, mental health, complementary medicine, health education, and podiatry. There's also a separate physical therapy and occupational therapy that is located at Princeton Club on the west side of Madison. So you may have, your primary care physician may refer you to one, or may refer you to this physical therapy location, or maybe the east side or Capital, whichever is convenient for you. We also have a mental health clinic. It's called Capital Regent Mental Health. This is where you can also have mental health services. It is close to the Capital Clinic. And I hope I did not go over this too quickly. So I am, I thank you very much for your time today. If you have any questions, please let me know.
Thank you so much, Laura, for sharing all of that with us. I'm going to turn off the recording in case anyone has any questions.
Perfect.